An emerging reality of President Donald Trump's second term is that the federal government will be doing less and states will need to do a lot more on everything from disaster relief to health insurance. The White House and Republicans in Congress are effectively trying to shift financial responsibility on multiple fronts away from Washington, D.C., in what could amount to a rewriting of the American social contract. In the big, beautiful bill, which House Republicans are tweaking before a likely vote this week, individual tax cuts from Trump's first term are made permanent and paid for by adding trillions to the national debt, according to estimates, and requiring states to spend more on the safety net of welfare programs that feed and provide health insurance to the poorest Americans. Trump traveled to Capitol Hill on Tuesday to pressure wavering House Republicans to support the bill. Even if GOP representatives can pass their House bill, they will need to work with senators on a version that can clear both chambers, meaning that much of what's below could change. CNN's Tommy Luby has a much more detailed look at the House Republicans' bill. States, for the first time, would have to pay for a portion of food stamp benefits, which are now called the Supplemental Nutrition Assistance Program, or SNAP. States and the federal government have long shared the cost of administering the program, but under the GOP proposal, states would go from paying nothing for SNAP benefits to being required to pay between 5% and 25%, as well as a larger portion of administrative costs. A state whose residents had gotten $1 billion in benefits would have to find close to $100 million to maintain those current benefits if it suddenly needed to match 10%. But if the state did not provide the full $100 million, according to an assessment by the left-leaning Center on Budget and Policy Priorities of the 2018 proposal, on which this part of the current bill is based, the federal matching funds might also drop since the federal government would be prohibited from paying part of the state's percentage. A state that paid $75 million instead of $100 million could actually see its SNAP benefits drop by $250 million. Medicaid is the program by which states and the federal government split the cost of providing health insurance to about 71 million Americans who live at or just above the federal poverty level. Republicans are still haggling over the specifics of their plan, and some lawmakers in the Senate have said they would oppose any cuts. On Capitol Hill, after giving Republicans a pep talk behind closed doors, Trump talked to reporters and denied any of these cost savings or cuts. "We're not touching anything. All I want is one thing, 3 words. We don't want any waste, fraud, or abuse," Trump said. One major expected change is that for the first time there will be work requirements for Medicaid. There is some question over whether those requirements would kick in starting in 2027 or 2029 as Republicans work to finalize the bill. Regardless, the bill achieves cost savings by assuming fewer Americans would have health insurance. A preliminary assessment of an early version of the bill by the Congressional Budget Office suggests Medicaid would cover millions fewer people by 2034. That figure would rise if work requirements are imposed in 2027. Medicaid spending has eaten up an increasingly large portion of state budgets, rising from about 22% in 2010, when the Affordable Care Act was passed, to nearly 30% in 2024, a figure that includes federal matching funds. Without the federal funds, states spend 19% of their budgets on Medicaid. The Affordable Care Act expanded coverage to people making up to 138% of the federal poverty level, $35,997.50 for a family of 3 in 2025. And the federal government footed most of the bill. 40 states and Washington, D.C. have now expanded coverage. Governor Gretchen Whitmer of Michigan, a Democrat, told CNN's Pamela Brown last week that states would not be able to backfill cuts in Medicaid spending.